Thank you, Dr. Cholera. I'd like to now, as we move into our program, call upon our first speaker, Lynn Thompson. And I am so honored to introduce you, Lynn. I don't know you, but I know a bit about you, and it's wonderful to have you come and speak about your journey and your story. So I'd like to welcome you to the podium, please.
Bonjour. Thank you for inviting me here. My name is Lynn Thompson, as it says there. I'm HIV positive. I've been HIV positive now for 17 years. Probably one of the longest surviving people in Saskatchewan, because we don't live here for very long. So I'm actually kind of a dinosaur and an icon here. If we want to go to the next slide, go to the next slide. So I just wanted to honor the land that I'm on, the Treaty 6 territory and homeland of the Métis. I come from Treaty 4. Thank you. And I'm from Pine Creek, First Nations, Manitoba. Although I never grew up there, I'm a 60 scooper, so I was raised in 27 foster homes and 2 adoptions. So I was... I'm well diverse in Canada's territories. Does it go that way? Okay, it's that one. Okay. So that being said, I wanted to come here and speak because I find it quite ironic. I've been in the HIV industry for 17 years, and this is actually the very first time that I've been invited as at this level as an HIV positive person. So I want to say kudos to the organizers, and thank you so much, Doctor, for allowing me to be here. And isn't that quite ironic that as an HIV positive person, we don't get to attend these conferences that are about us, and it's often about us without us. So I'm hoping to change that in this speak today. And I found it kind of ironic that you had this title, Mysteries and Myths of HIV in Saskatchewan, because as a positive person, we have lots of mysteries and myths of HIV and Hep C. So I just wanted to maybe shed some light on that. I have been asking my community members, and I always ask my community members when I get this privilege, as to what to say to you guys. How can we make it that we're not just a number, we're actual real people? So, you can read this, right? I don't want to kind of have my back to you, but we can live with HIV in Saskatchewan for decades. True or false? You guys will probably say true because you're all from the academia and the medical part. But in Saskatchewan, that's actually quite false. Like I've told you, our life expectancy here is usually about 2 to 5 years. Very rarely do we live longer than that. And we do have people living longer now, but it's really, really hard to find them and actually come and get treatment. And treatment itself is extremely difficult. And this is from one of our doctors, that we have 2 people dying 2 every month. Isn't that amazing? And we actually have 30 new cases a month also. So to me, that's just staggering figures. And how come we haven't done anything before, or how come whatever we're doing is not working? So they want to know just as much as I want to know. HIV is the gateway to more narcotics. What do you guys think of that comment? Are you quite shocked? And these are actual answers that I got back from the people. They said, and you know what? HIV is no longer a scary thing. It still has stigma and discrimination attached to it, but our people our First Nations people, I'm not sure what's happening right now. It's like they don't care anymore. Our young people really don't care. And they always say everyone has it, so who cares? And true, they do get more drugs from their doctors often because they're quite sick, so they often will get extra narcotics on top of their HIV meds. And this is a known thing. And I think some of that has to do that we live in such extreme poverty in this city that we're actually selling our medications so that we can get diapers, so that we can have milk. Even a loaf of bread is quite hard for us because we live on such a limited income. And that's true. I think we find in our reserves that even our elders sell their medications because we live in extreme poverty. Some of the mysteries here, I asked what they were. Some of our First Nations people still believe that their family members won't give it to them, and how could they? And we have the same blood, so it's often that they will transfer, and we will see whole family members contract HIV. Just a few years ago, I had one mom that had 6 of her children at St. Paul's Hospital, and they were dying just one after another. So we're like that's devastating for our Mushums and Kukums to have their whole children wiped right out by this illness. So that's scary. Did you guys know, I know that we push with the HCV that we have a cure now. And we always say cure, and I don't like that word because it's not a cure because we can still contract Hep C. So our people have transferred that, going, well, they cured Hep C, well, they'll probably cure HIV. So that's kind of where some of our people are going in that direction. So when we do campaigns, I really, really ask that we use our wording much, much more better and more maybe appropriate. And this is very, very common, especially for us positive people, because that's what it feels like, you guys. It feels like everybody around us makes money except the person here, living here. I'm living with HIV, you guys. When I first started doing these speaks, I would get $10 a day. And I would spend my whole day here. And you were always that token Indian or that token HIV positive person. I'm not that positive. I am that positive person, but I don't want to be that token Indian. So for us, this is what it feels like, that HIV is an industry, and the people are profiting off our backs. Oops. So these are some quotes that we have here from some of our physicians here that work in our city here in Saskatoon. Over 10 people are being diagnosed with new infections every month, and that's only going up. And we see that, right? You just did that in your chart, that we're increasing incredible amounts. And I don't know if you remember Dr. Ryan Miley. A couple of years ago, we did try to do an HIV public awareness and crisis, and we asked, Dr. Ryan Miley kind of asked me and another lady from Regina, and I thought it was weird that since he is one of our physicians here at the Westside Clinic and freely hands out many, many prescriptions, but yet here the doctor is calling on a HIV crisis, and I often feel like some of our physicians here need to be more monitored. And I'm not coming here as to condemn you guys or condemn what you do as a profession, but I'm asking and begging for help, because it will take all of us, not just me, not just you. It will take the whole community, researchers, biologists, chemists, to solve our problem here. I don't know if you guys know, but I'm going to walk here because I'm a person that has, for 17 years, lived with HIV. Out of that 17 years, 15 years, I only used traditional medicines. And I'm still alive. And I look this good. So that being said, I wanted to touch a little bit on the traditional medicines that I've used. I did ask my elders how much I could speak about this, and they're still telling me to keep it pretty under wraps because I go and pick my medicines. And they are worried that if I do tell them some of my medicines that I do pick and the roots that I use, that we would have our pharmacists come and strip the whole land. So our elders are still quite worried about this. So they've told me not to specifically say what's in my tea, but it's a tea that I drink, and it's every morning I drink a tea. And I got rid of my Hep C. I had Hep C for 23 years. Cured my Hep C with my tea. Right now, I just turned 50, you guys. So I think some of that tea has to do something with it. So I honestly believe very much in my traditional culture and the beliefs that I have. As a 60 scooper, I'm just starting to learn my own culture, and it's been about 5 years where I've really dove into being mentored and trained by a traditional medicine woman. And that elder comes from Onion Lake, and I love her family. They've taken me in, and they've shown me all my medicines, and we go medicine picking every summer. And when I do my medicines, it's not just the tea that I drink. I also have to do all the 4 components like the medicine wheel, which involves mind, spirit, motion, and body. So that includes everything. I have other positive people that will often say to me, well, I want to do what you do. And I can't just give you the tea. It's a whole approach, a holistic approach to my health. I had to go on Western meds about 1.5 years ago, and it's been the hardest transition in my life. And I only use 1 pill a day. I know some of my people have to use up to 12. Can you imagine timing your whole life as to what pills you're going to take and when, with water, without water, with food, without food? It can be quite hard to navigate, and I just have 1 pill. But it's a very harsh pill. And I know that people say there's no side effects to them. There are huge side effects to them. I use Stribal, and that's the newest and latest drug on the market, but it kills my kidneys. It hurts my kidneys, you guys. And I know our physicians say, oh, no, there's no side effects. There are side effects. So I still use my Western, or my traditional medicine to alter the Western medicine. Ideally, I'd like to just go back on my traditional medicine, and hopefully, I don't know, maybe one day I will, maybe one day I won't, but that's kind of where I'm sitting with my traditional medicines. And I pick up my traditional medicines, you guys, in the northern Saskatchewan. So we have lots of traditional medicines here, very powerful medicines. So I'd like to honor my culture and Treaty 6 territory, and Treaty 10 territory, where often I get my medicines. I think this was about... These are some of the people that passed away just actually probably in the last 6 months. Isn't that a lot, you guys? Oops. I'm going to your slide. So isn't that amazing? And look how young my friend is. She just died in January. And she was only 22. Clarence was only like 35. Kinsey was only like 40. Dean was only 49. So we're dying at very, very young ages, you guys. We don't live to be very old here. So when we talk about living a long time here, can you please keep in mind that in Saskatchewan it's very different. On a national level we do, but here in Saskatchewan, I don't know what it is, you guys, and I think a lot of it might have to do with, we had a lot of residential schools here. We had lots of 60 scoop survivors here, so it made huge impacts on the decisions that we make today. So that being said, I just will always honor the people that have passed on, and I do this work for these people, and I promised them that I would continue to do that, and I hope that I can do that in a good way. Thank you. I had